Hello, I'm one of the midwives here at Leighton Hospital. I'm here today to talk to you about some information you'll need to know about going home after you've had your baby. So first things first, one of the most important things that you need to do is you need to make sure that you provide your discharging midwife with your most up-to-date contact number and your up-to-date contact discharge address. It's so that your community midwife can contact you once you've gone home. Your community midwife will normally try to contact you within 24 hours of leaving the ward and arrange to come and visit you at home within the first 48 hours. If you do have any questions or any concerns before your community midwife does contact you or at any other time, please feel free to contact Ward 23. All of our hospital telephone numbers are in the inside of your handheld notes. Following your first visit with the community midwife, which we like to call your primary visit, all visits after this point will be tailored to your individual needs. So the community midwife will come to visit you either if you need her to or if she needs to come and do something specific. On day 5, that's one of the days where the community midwife likes to visit all of our mums and babies. And that's because we like to offer you a blood test on this day called the newborn blood spot test. This test tests for 9 rare conditions, things you'll never really have heard of. Things like maple syrup urine disease, MCAD and PKU. Your discharging midwife will be giving you an up-to-date leaflet, giving you all of the information that you do need to know about having this test done. It's a simple heel prick test that the community midwife normally comes to your house to carry out for you. Just occasionally, we do ask you to come into the hospital because sometimes we've got lots of babies that need that test doing. We'll do them all in a clinic on the same day. The blood that the midwife takes on that day gets sent off to the lab for testing, and it normally takes 6 to 8 weeks for you to get those blood test results back. We always take an up-to-date patient's contact number when we do take that test, so if we've got any concerns, the lab can contact you directly. Following on from the blood test which your baby will be having on day 5, the community midwife will also be wanting to weigh your baby on this visit. That's because we expect all babies to have lost some weight postnatally. What we're interested in is picking up the babies that perhaps are losing too much weight, which could be linked to poor feeding, or it could be linked to an underlying medical condition. So the community midwife will be weighing your baby on day 5, and we're expecting your baby to have lost some weight. The community midwife will just be telling you the results of this. If she has any concerns, she will tell you, or if we don't, we won't want to be weighing your baby again until your baby is 14 days of age, and it's normally the health visitor that weighs your baby then. At this point, your baby should be roughly back to being its birth weight. However, if your baby has been born prematurely or of low birth weight, we know those babies are more susceptible to weight loss, so those babies will be offered an early weigh on day 3. Your baby's health visitor will normally try to contact you when your baby is roughly 10 days of age. They normally do this via the telephone, and they aim to arrange a visit to your house when baby is about 14 days of age. However, health visitors only work Monday to Friday, 9 to 5, so they'll never conduct those visits over a weekend. You may in fact have already met your health visitor whilst you've been pregnant. Health visitors are responsible for guiding you through weaning, feeding, child immunisations and child development. Following your discharge from the hospital, there are a few jobs that we need you to do. First job you need to do is register your baby's birth to get baby's birth certificate. On the inside of your handheld notes, your discharge midwife will be putting some information in there, including a telephone number and an address, so you can ring up and book this appointment. When you go along to that appointment, you'll get a short birth certificate for free. However, if you ever do want a passport for your baby, you'll need to buy a full or a long birth certificate on the day. There is a small charge for this. Once you've got your baby's birth certificates, that's when you can send off for your child benefit. To be able to do this, you need to access your child benefit claim forms, which you'll either find inside your bounty pack or you can access these easily online. The only other job that we do need you to do when you go home is to register your baby as a new patient with your GP surgery. We always recommend you do this by the time your baby is about 2 weeks of age. And to be able to do this, you'll need your baby's NHS number, which you can find on your delivery summary, or you can ask your community midwife or discharge midwife to point this out for you. When your baby leaves the hospital and goes home, your baby does need to be in an appropriate car seat. The law in the UK recommends that all babies remain rear-facing in a car seat until they are 15 months of age. We always recommend that you try to keep your baby in the back seat of a vehicle where at all possible, and make sure that you switch off airbags appropriately. We always recommend that you don't leave your baby unattended in a car seat or for prolonged periods. Most manufacturers currently recommend that a baby isn't left in a car seat for more than 2 hours. We also want to make sure that your baby doesn't overheat and that the straps fit appropriately whilst in a car seat, so we don't recommend the use of a snowsuit or thick coats or cardigans. We also recommend that if you are using a previously owned car seat, that you do make sure that it hasn't ever been involved in an accident or damaged in any way. We want to make all our mums aware of the National Screening Campaign, which encourages all ladies to self-examine their breasts once a month for any signs of breast cancer. We want you to make sure that if you pick up any signs or any changes, or you're just generally concerned, that you do speak to your community midwife or go to your GP to get these checked out. Pelvic floor exercises are extremely important following the delivery of your baby. We always recommend that everybody recommences pelvic floor exercises as soon as possible. Pelvic floor exercises will help maintain good health and strength in the pelvic floor area, and it will also aid perineal healing because it does encourage a good blood supply to the area. You can find some more detailed information about pelvic floor exercises either inside your pregnancy information booklet or on our webpage. For the first 3 months following the delivery of your baby, people tend to find that they're extremely fertile, even people that have needed fertility treatment to get pregnant this time, which is why arranging some contraception is really important. For our breastfeeding mums, the only type of contraception that you can't use is the normal combined oral contraceptive pill. You can go on a pill, but it would just need to be the progesterone-only mini pill. Apart from that, you could choose to use any type of contraception that you wish, such as the coil, the implant, the depot injection, or condoms. For our bottle feeding mums, you can use any type of contraception that you wish. The reason that we recommend that you use the contraception is because people can get pregnant very easily. We expect your first period to arrive between your baby being 4 and 8 weeks of age. However, you can get pregnant before this time because you always release an egg 2 weeks prior to the arrival of your first period. So please get some contraception sorted. Contact your local GP surgery. Lastly, what I want to talk to you about is all the information about sudden infant death syndrome. You may have also heard this being referred to as Cot Death. Don't panic too much. What I want to do is highlight the risks to you and give you some pointers and some advice to help dramatically reduce the risk of this happening. Your health visitor and your community midwife will also have some more information to give you about this subject. Here in the UK, currently 1 in 3,000 babies dies of cot death. Here in the UK, the leading cause of cot death is second-hand cigarette smoke exposure, so it's really important that you have a smoke-free house and a smoke-free car. Anybody that does smoke cigarettes or vapes should never have any close contact with your baby for at least 20 minutes after having had that episode. Always make sure that you show good hand washing technique and change your clothes where appropriate. Bed sharing is the second biggest cause of cot death in the UK. We always recommend that you don't bed share with your baby, particularly if you or your partner smoke, drink alcohol, take drugs, or your baby was born prematurely or of low birth weight. We always recommend that you have your baby sleeping in your bedroom with you for at least the first 6 months in its own safe sleeping environment. That's either a cot, crib, Moses basket, or next to me. When you place your baby down to sleep, we always recommend that baby sleeps on its back with its feet towards the bottom of the sleeping environment, covers no higher than its armpits, and that's to prevent the covers ever covering baby's face. When a baby is sleeping in a cot, crib or Moses basket and it's less than 12 months of age, we never recommend that a baby sleeps using a pillow or on top of a pillow or a beanbag. We also never recommend that children under the age of 1 sleep using a duvet cover or a quilt cover. We also do not recommend the use of cot bumpers, and we also want you to be careful not to put any toys in baby's safe sleeping environment. What we don't want is anything that's large enough that could fall on baby's face and increase the risk of suffocation. Sleeping bags for babies are increasing in popularity. We never recommend that you use sleeping bags until baby is sleeping within a big cot environment. We always recommend that you pay particular attention to the TOG rating of the sleeping bag and always ensure that it fits correctly. Always use an appropriate room thermometer alongside these sleeping bags to ensure that babies are never going to overheat. More babies die of cot death when they overheat, which is why it's really important to prevent this happening. When a baby is healthy and it's term, it never needs to wear a hat when it's more than 24 hours of age. If you ever want to check the temperature of a baby, never go by the temperature of baby's hands or head. They will always feel a little bit cooler. What we want you to do is we want you to go by the temperature of baby's chest or baby's back. Ideal room temperature is round about 18 degrees, and we never recommend that a baby sleeps by a radiator or an open window. What we want you to do is remember that babies should never wear more than 12 togs at any time. If you want further information about the tog value of clothing and blankets, you can find them on our webpage. Some research suggests that giving your baby a dummy when you put it down to sleep can help reduce the risk of cot death. If you do want to introduce a dummy to your baby, we always recommend that you wait until breastfeeding is established at round about 4 weeks. If you do choose to use a dummy, we recommend that you use it consistently as part of baby's regular sleeping routine, as research suggests that only partly using a dummy doesn't reduce the risk of SIDS. We recommend that you stop the use of a dummy between 6 and 12 months, never force a baby to take a dummy, and never reinsert a dummy if a baby spits it out. If you have any questions or queries about anything that's taken place in your pregnancy or with us during your stay after having your baby up on the ward, please feel free to ask any member of staff prior to being discharged home. And finally, congratulations on the birth of your baby. Please look forward to taking your baby home and enjoy that lovely time together. If you do have any questions or any concerns, please ring us. All of our telephone numbers are in the inside of your handheld notes.